Sophia, a woman in her mid-50s, walks into Dr. Lee's office, worried about her recent symptoms. Her heart pounds nervously in her chest, echoing the discomfort she's been feeling of late. Sophia is not one to ignore her health, so when she began experiencing chest discomfort, shortness of breath, and fatigue during physical activities, she knew it was time to seek professional help. Lee, a seasoned cardiologist with years of experience, welcomes Sophia into his office. His calm demeanor brings a sense of comfort to Sophia. He listens attentively as Sophia starts to explain her symptoms, the worry evident in her voice. Dr. Lee, with his years of training, understands the gravity of these symptoms. His eyes are sharp and focused, his hands diligently taking notes. Meanwhile, Alexander, an eager medical student shadowing Dr. Lee, is soaking in the interaction. He's studying to be a cardiologist, and observing a seasoned professional like Dr. Lee is a valuable learning experience. He pays close attention to Dr. Lee's questions, the way he listens, and how he empathizes with Sophia. He notes Sophia's symptoms, linking them with possible cardiac conditions he has studied. In the midst of her worry, Sophia appreciates the attention and care she is receiving. She feels heard and understood. It's reassuring to her that she's taken the right step by seeking professional help. Sophia knows that understanding her symptoms is the first step towards finding a solution. Dr. Lee, after carefully listening to Sophia, acknowledges her concerns. He reassures her that they will figure out what's happening. His words are filled with assurance, his tone comforting. Sophia feels a wave of relief wash over her. It's not the end, but merely the beginning of her journey towards understanding her health better. "Thank you for being open about your symptoms, Sophia. Let's figure out what's happening," says Dr. Lee. His words mark the end of Sophia's visit, but the beginning of her journey towards better health. Scene script. Dr. Lee begins to explain the possible cause of Sophia's symptoms. He begins, "Sophia, we've been looking at your symptoms, and one possibility we must consider is a condition known as coronary artery disease, or CAD. To confirm or rule out this, we may need to perform a cardiovascular stress test." Dr. Lee goes on, "A cardiovascular stress test is a procedure that requires you to do some physical exercise, typically on a treadmill or a bicycle, while we monitor your electrocardiograph and blood pressure. The goal is to see how your heart responds to exertion." He continues, "Now this test is particularly used for patients with an intermediate pretest probability of CAD. This probability is determined based on a few factors like age, gender, and symptoms. It means that you fall somewhere between a 10 and 90% chance of having CAD before we conduct the test." Dr. Lee further explains, "The results of this test help us stratify patients into risk groups. If the test shows low risk, we can treat the patient medically without any invasive testing. If it shows an intermediate risk, we may need to perform additional testing like exercise imaging studies or cardiac catheterization, and for high-risk patients we would refer them for cardiac catheterization." Dr. Lee then proceeds to the next point. "It's important to understand that there are certain indications for terminating the exercise stress test prematurely. These include a drop in systolic blood pressure of more than 10 millimeters of mercury from baseline, despite an increase in workload, moderate to severe angina, NEST elevation in leads without diagnostic Q waves, increasing nervous system symptoms like ataxia, dizziness or near syncope, signs of poor perfusion like cyanosis or pallor, technical difficulties in monitoring ECG or systolic blood pressure, the patient's desire to stop, or sustained ventricular tachycardia." He adds, "These are all signs that the test may be causing undue stress to the heart, and it's safer to stop the test than to continue." Dr. Lee wraps up his explanation. "The most commonly used ECG criteria for a positive exercise test is 1 millimeter or more of horizontal or downsloping ST segment depression or elevation. This occurs at least 60 to 80 milliseconds after the end of the QRS complex, but we'll talk more about the interpretation of the results later. Understanding the nature of the test is vital, Sophia. It's a tool we use to stratify patients into risk groups," Dr. Lee concludes. Dr. Lee delves deeper into the subject, explaining the interpretation of the test and the concept of nuclear cardiology. "Let's talk about how we interpret the test results," Dr. Lee begins. "The most commonly used ECG criteria for a positive exercise test is 1 millimeter of horizontal or downsloping ST segment depression or elevation. This occurs at least 60 to 80 milliseconds after the end of the QRS complex, which is a part of the ECG wave that represents the electrical activity of your heart." He then transitions to the topic of nuclear cardiology, a field that uses radioactive substances to study the heart. Nuclear cardiology includes a test called myocardial perfusion imaging with ECG-gated single-photon emission computed tomography, or SPECT for short. It uses a radio-labeled tracer to evaluate your heart's function, detect ischemia, and assess perfusion and left ventricular function simultaneously. Dr. Lee continues. This test predicts the likelihood of further cardiac events independent of your history, examination, resting ECG, and stress ECG. It's often called a MIBI scan, named after the radio-labeled tracer, sestamibi. The stress for this test can be induced either by treadmill exercise or intravenous vasodilator stress. We obtain images of your heart during stress and at rest 3 to 4 hours later, he adds. A fixed defect indicates impaired perfusion at rest and during stress, suggesting an infarcted or hibernating myocardium. A reversible defect, on the other hand, signifies impaired perfusion only during stress, which is indicative of ischemia. He then introduces the concept of stress echocardiography. In situations where ECG is uninterpretable or the patient is unable to exercise, we use stress echocardiography. This test helps us evaluate the clinical significance of valvular heart disease and decide on the potential efficacy of revascularization post-acute coronary syndrome. These tests provide us valuable information about your heart's condition and guide us in determining the best treatment approach, Dr. Lee explains. Scene script. Dr. Lee concludes the discussion emphasizing the importance of these tests. He begins by highlighting the necessity of stress testing in the initial evaluation of patients. You see, Sophia, he starts, stress testing plays a pivotal role in diagnosing heart conditions. It's like the first line of defense. By observing your heart's response to stress, we can determine if there's a potential problem. He continues, a cardiovascular stress test uses treadmill or bicycle exercise with electrocardiographic and blood pressure monitoring. The results of this test allow us to stratify patients into risk groups, which helps us to create a tailored treatment plan. Dr. Lee then takes a moment to elaborate on the process. We monitor certain changes in your heart during exercise, like the ST segment depression or elevation on an ECG, for instance. These changes can give us valuable insights into the state of your heart's health. Moving forward, he explains the role of nuclear cardiology. Myocardial perfusion imaging, often denoted as an MIBI scan, is another crucial tool we use. It helps us evaluate myocardial viability, detect ischemia, and assess perfusion and left ventricular function simultaneously. He then pauses, ensuring Sophia is following along. What this means, he clarifies, is that we're able to observe how well your heart muscle is perfused or supplied with blood. This can predict the likelihood of further cardiac events independent of your history, examination, resting ECG, and stress ECG. Dr. Lee also underscores the importance of these tests in deciding the potential efficacy of revascularization, a procedure to restore blood flow to the heart, and in evaluating the clinical significance of valvular heart disease. He concludes, these tests aren't just about monitoring and diagnosing, Sophia, they play a fundamental role in guiding the treatment plan, helping us understand how to best manage and treat your condition. These tests are not just procedures, Sophia, they're critical steps in understanding and treating your condition, Dr. Lee states. Dr. Lee wraps up the conversation with a crucial message. He leans in, earnestness clear in his voice. Every patient is unique, Sophia. Your case, like many others, has its own particularities. The symptoms, the stress test results, the nuclear cardiology readings, they all tell a story that is uniquely yours. He pauses for a moment, letting his words sink in. That's why professional consultation is so important. Medical practitioners are trained to read into these details, to understand the individual narratives that each case presents. His voice is gentle yet firm, underscoring the gravity of his message. It's not just about knowing the disease, but understanding how it manifests in your body specifically. He encourages Sophia, and by extension everyone else, to always seek professional medical advice. Always remember, different people have special cases. It's essential to consult professional providers to understand your specific situation, Dr. Lee concludes.